Welcome to Heart Dialogue, where we believe that meaningful dialogues have the power to inspire, heal, and connect us on a deeper level. In this podcast, it's also about gathering and lifting a whole community up. Let us stand in response to people's cries and generate a current of dialogues for a better world. Let's HTHD! So Dr. Dinesh has been in medical practice for more than 25 years already.
Yes.
Wow. And in the specialist area of cardiology for more than 20 years.
So cancer and cardiovascular disease,
Yes.
are the top two, definitely. What happens in most heart disease that we see these days is that you get blocks in the arteries supplying the heart muscle. But what you see then is the lumen or the passageway or the hole through which blood flows gets smaller and smaller
Yes.
as the yellow bit of the block goes up. The funny thing about exercise is your risk of a cardiac event is actually higher during exercise.
How has COVID-19 impacted heart health, and what precautions should the patients take? Thank you for coming.
Oh, thank you for having me on the show. Glad to meet you again. You know, we met just a few weeks back at another talk.
Yeah.
Yes. That's how it all started. So thank you for having me on the show. I'm looking forward to it.
It's my pleasure. Before we officially start, right, just want to introduce a little bit about Dr. Dinesh.
Okay. Yeah.
And he has worked in different countries, and now he is currently at Mount Elizabeth Novena Hospital.
That's correct. Yes.
Okay, once again, thank you for being a guest on the podcast today.
No, my pleasure. And thank you most of all for this very cool pillow that I have down here, same as yours. So this is the first time I've done a talk holding on to a pillow like this. So thank you. There's always a first for everything.
Yes, just thought I want to make everything cozy,
Yes.
relaxing.
Yes.
Okay. Actually, I've prepared like a screenshot. I
Sure.
found it from the MOH about the top 10 causes of death. Maybe we can have a look at that.
Yes. Yes, I can see that. This is the MOH data.
Yes.
Yes.
As we can see, right, by right, heart disease is actually top 3. But then since you mentioned about
Yeah. So the thing is on that, they put cancer as number 1, pneumonia number 2, cause of death, of course, and ischemic heart disease. But if you look down at 3, 4, cerebrovascular disease,
yes,
and also 8 other heart diseases, if you put them all together, then what you have is something called cardiovascular disease, which means heart disease, including stroke, and all of that being one type of disease, because the causes are the same, the treatment's very often the same. Very often the treatment's the same as well. The risk factors, the treatment, the way we manage it long term, and if you have the risk of a stroke, you tend to have a higher risk of heart disease, high risk of stroke. So sometimes you put that into one continuum or one collection. And if you put it that way, it actually tops cancer and goes above if you add all the numbers up.
yes, we've added all together, it will be about close to 28.
Yeah. So cancer and cardiovascular disease,
Yes.
are the top 2, definitely.
So Dr. Dinesh has been in medical practice for more than 25 years already.
Yes.
Wow. And in the specialist area of cardiology for more than 20 years. I see. Yeah, I think it's a very interesting point because I didn't look at it that way before.
Yes.
Yeah, I think this is kind of alarming, isn't it?
Yeah, it is. So it's one of the biggest things. Well, what are we always concerned about? Heart disease, stroke, cancer. And
Yes.
once you put heart disease and stroke together, it's cardiovascular disease and cancer. These are the biggest killers that we have, of course.
Yeah, and speak about heart disease and stroke, right? What are the difference, especially like heart attack and stroke? What are the difference?
Yeah, so I mean, I know you brought a heart model, and we
Yes.
can probably look at that too. But interestingly enough, I always use my hand as an example as well. Your heart sits in your chest like this, and arteries sit on top, and your heart pumps away
Okay.
like that. And there's arteries like this, and the heart pumps blood to itself and to the rest of the body. But if you use this cool model that you have here, which we
Okay.
can then use, I don't know if you all can see this from where I am.
Yeah, I think.
Yeah, okay, that's quite well, we have to put it in front of this. Okay, so where we can see it.
I think maybe we zoom in.
Now, we might be able to zoom in.
Yeah.
What you'll see is that the heart sits in your chest like this, okay? Points towards this side. There's a left side and a right side of the heart. I think I'll move this slightly away.
Thank you.
And if you looked at the inside, everyone remembers the heart's got 4 chambers, right? You remove this, you'll see 4 chambers, top 2, bottom 2 chambers.
Yes.
That is not so much of an issue, but what happens in most heart disease that we see these days is that you get blocks in the arteries supplying the heart muscle.
I see.
So a big block in the heart arteries, okay, that occludes 100% causes a heart attack. So if you've got a big block here running down the arteries that the heart pumps blood out of to itself and to the rest of the body, if that artery goes down towards the heart muscle, and if that heart artery's got a block, and if that block's 100%, you get a heart attack. The same way if you got a big block going up towards your head, and these are arteries going up towards your head and supplying blood to your brain, if you get a big block here, worst case scenario is a brain attack or stroke. So that's why we call it cardiovascular disease. Cardio meaning heart.
Yes.
Vascular is vessels. Cardiovascular, heart and vessels disease.
Yes.
And blocks in any of these vessels can cause a problem. Now, there are a lot of other diseases, of course. I mean, the biggest killer is ischemic heart disease, according to that chart that you showed among the heart diseases. But you have other stuff as well, heart muscle disorders. You have strokes coming up.
Yes.
Where you can get either a clot blocking off the supply to your brain, or you have a bleed in the brain. You had another model somewhere there, yes.
It's over here.
Maybe we could pull this up. So this was, if you take your arteries, okay, and they supply the heart like this, okay, going down, and you cut through it.
Yes.
Okay, it's a cross section.
Okay.
What you have is your blood flow inside here, and this is the artery.
This is normal artery, right?
Normal.
Okay.
Perfect. So if you think of it as a pipe, so what's your heart? It's a pump and pipes.
Yes.
And there's an electrical system.
Okay.
It's actually a little bit like a house, if you will.
Okay.
So if you've got a house and it's got a pump and pipes and electrical system,
Okay.
as your house ages, what you tend to find is that certain parts of it wear down.
Yes.
Right? So the arterial system or the pipes, if you've got blocks in one pipe, you tend to have them in another one in a house. So this is a clean pipe, right?
Okay.
But if you get a little bit of gunk, and this gunk flowing down, and that's cholesterol building up in the inside of the artery here, you get a small block.
So the yellow color here represents cholesterol.
Small block in there.
Okay.
This is a bigger block, and this is a very big block. But what you see then is the lumen, or the passageway, or the hole through which blood flows, gets smaller and smaller
Yes.
as the yellow bit of the block goes up. So when it hits something like this, people tend to get symptoms, or they get chest pain, breathlessness. If it blocks off 100%, that's a full heart attack. Yeah, so that's kind of how a heart attack works. But the same thing can happen for the arteries going up towards your head. The ones in here, like the neck arteries, these are called the carotid arteries. If they're blocked off 100% suddenly, they can cause a brain attack or a stroke.
Oh.
But usually what you get is a blocking off of the smaller arteries up inside the brain
Okay.
that causes stroke.
I see.
Yeah. So that's why they're all part of one continuum or one type of disease.
So it's interrelated.
It's interrelated, of course.
Also to check, right? Because like this afternoon, just so happened I talked to my friend, and then we were talking about having chest numb on the chest.
Okay.
Does it always related to heart or not always the
Yeah.
case?
So this is actually a very good question, Candy, because the funny thing about heart diseases and heart attacks is that 50% of people who have real big blocks in their heart arteries actually don't have symptoms. 50% of people who get heart attacks, there's been some data in some published studies where you just take a bunch of people, look at them, scan their hearts, looking for heart attacks. 50% of them who have had heart attacks have had silent heart attacks, meaning they never had any symptoms.
Okay.
They didn't know if their symptoms were heart related. And you often have, this description in the movies, you watch movies where they say, oh, the guy's having chest pain, or an advertisement, chest pain, crushing chest pain, going down your arm, going up towards your jaw, breathlessness, suddenly collapsing.
That's a serious case.
That's a serious case, but less than 50% of people actually have those symptoms.
Okay, I need to pause a moment. When you mentioned about the silent heart attack, what do you mean by that?
Yeah, so if we go back to the same story again, I said 50% of people get the classical symptoms, the other 50% don't.
Okay.
Then what you have are no symptoms sometimes and atypical or not very typical symptoms. Very often it might be what people think is gastric pain.
Oh.
Yeah, so we've had
burning sensation.
and that's where the whole thing about heartburn came about. People say heartburn, your heart's not burning, right? But what you're getting is in the heart area, you're getting burning sensation, gastritis.
Yes.
But because all your nerves are in the same area, you have your nerves from your chest, nerves from your spine, nerves from the gut, nerves from the heart, and they all sit in one area. Your body gets confused. Your brain gets confused. You can't tell where the signals are coming from a lot of the time. So that's why what you get are these atypical symptoms. Now, atypical symptoms can be like gastritis.
Okay.
We've had many patients coming in thinking they've got gastric pain, and what they end up with is a heart attack when they go into the A&E because that gastric pain doesn't seem to go away. Right?
I see.
They do an ECG. A doctor attends to them. Sometimes on a blood test, you get enzymes going up showing heart muscle damage. Then you realize, God, that's really a heart attack. But sometimes it is not a heart attack. It is just angina. Angina is when you get chest pain without the heart muscle getting affected. Right? And that is because the block is so severe. Your heart, once again, pumps in here. You have your arteries on top. The heart arteries don't supply enough blood to it because there's a block in it.
Yes.
And if there's a block in it, not enough oxygen goes into the heart muscle. So, like if you exercise a lot and you get cramps or you get muscle aches, the same way your heart is a muscle, it gets that kind of muscle ache as well from lack of oxygen.
So it's all started with the blockage.
Yes, that's what it's mainly about.
So it's because of the cholesterol or maybe genetically, is there any relation between?
Okay, also a very interesting question. 80-90% of blocks in the heart arteries or heart attacks, etc., come from cholesterol plaque building up on the inside of the arteries. So what happens is you have an orifice like this, and it narrows and narrows and narrows because the cholesterol plaque builds up. And if it occludes 100%, that's when you get your heart attack, right? Now that's simple enough and everyone understands. Okay, cholesterol buildup causes it. Cholesterol being high, the more circulating cholesterol you have, the more, it's like gunk flowing down a pipe.
Yes.
The more of it sits around on the inside and it can close off.
Yes.
And that's fine. But some people are born with congenital issues where their heart arteries run the wrong way. There are people where the arteries are supposed to come out from the left side or the right side and they run into the opposite direction, or they run through muscle and get squeezed. So there's a lot of other possibilities as well.
Okay.
And that's how squeezing of that muscle can also cause a heart attack, the muscle over the artery. So let's say your heart's beating like this. And you've got this thing. Now, there's a condition called a myocardial bridge, where normally the artery sits on top, but here it tunnels through the muscle and it gets squeezed like this. And if it gets squeezed and your heart rate goes too fast, then you get lack of blood flow. You can get symptoms from it. You can get a heart attack from it. You can get damage to the heart muscle from it, and usually abnormal heart rhythms as well. So there's a lot of stuff associated with it. But if we were to simplify it and bring it back to basics, the most common cause is cholesterol buildup inside the pipe, causing a blockage.
So that's the most common. At least I think the audience got to know that the most common causes to heart disease is actually cholesterol.
Yes, entirely.
Another curious questions to ask, is there any specific age group whereby, the risk of getting heart attack is the highest, they have the highest risk?
That's interesting. So remember I mentioned to you that your heart's like a house. Okay, you've got a pump, the heart pumping the blood away. You've got the arteries sitting on top of it where the heart pumps blood to the arteries, back towards the heart muscle. And then you've got an electrical system that governs the whole thing, right? So as you age, things wear down. It's like a house hitting like 50 years, 60. Yes, wear and tear. So is there a particular age? Yes, the older you get, the higher your risk. When you hit your 40s, 50s, 60s, this is where most people start developing heart issues.
I see.
And every 10 years of your life that you move on, your risk goes up. As you age, there are a lot of 50-year-old people, 50-year-old people who have blocks in the heart arteries who may not know it.
Yes.
That would be an age at which you might want to check. We tell people, generally if you hit 40 and above, have a check. Simple tests like blood tests, cholesterol, your blood sugar, blood pressure. Make sure all these things are in order. And if you've got some symptoms or if your risk factors are a little bit high, you can consider doing a CT scan in your heart arteries. That's just a scan, a picture, CT scan, look to see if they're blocks, right? But many people don't have symptoms, so they don't tend to do those tests then. So they tend to manifest a little bit later, in their 60s, 70s, bang, heart attack.
When the artery 100% block could be.
Yes, or nearly 95%. And that's when the symptoms tend to occur for the majority of people.
So to summarize a little bit, Dr. Dinesh is maybe, are you recommending like maybe at the age of 40 plus, we should, even without symptom, we should go for like maybe just a basic checkup? Like
Yeah, so this is a difficult question to answer, mainly because there's a lot of things attached to it. Cost is one.
Okay.
Can everybody afford to go and do a test very early? What facilities are available for a general checkup for the population? So I would say if you cross 40, that is the minimum age at which you need to have a look to see if you've got blocks in your heart arteries, check to see if you've got diabetes, cholesterol, that kind of stuff. But that doesn't mean you can't check when you're younger.
True.
So when you're younger, there's nothing to say you can't do it when you're 20, but you may not be able to get access to those tests so easily. There is not necessarily a national program to do it. But if you can afford to go and just do a simple test with your GP or your polyclinic doctor, just want to check my sugar, my cholesterol, you can get that done too.
Yeah, at least the simple blood test.
Simple things to start with.
Like for me, I'm 33, right? I went for my blood test and my cholesterol is actually at the borderline.
Okay.
Is this something I need to worry about?
So when it's borderline by the standards set according to the guidelines, that means it's high. Borderline is high, right?
Okay.
It's whether it's a little bit high or very high, your risk is higher than somebody whose cholesterol is very low.
Okay.
So what does that mean? You need to make lifestyle changes.
Okay.
First of all, cut down fat, cut down sugar, exercise more. A lot of cholesterol is not just your lifestyle though. Your lifestyle, probably your food accounts for 25% of your cholesterol. The other 75% is produced by your body.
Okay.
So actually 75% of it is practically genetic.
Wow.
But by lifestyle changes, you can change your risk. You can reduce your risk overall.
At least prolong the risk.
Yeah, at least reduce that risk significantly. Then what you need to do, and the problem is many people go and do a blood test. Okay, they say,
Yes.
okay, I check my cholesterol, it's high. I've been told it's borderline. Okay, I need to watch out. Then they do nothing about it.
Yes. Nothing about their the things that they eat,
Yes,
lifestyle.
precisely. And they never go and check it again. Because, okay, I need to know. 5 years later is the next time they go and check. And by that time, if your cholesterol remains high and you might be on an upward slope where your
Yes.
cholesterol is going up, and it's so much higher and it's caused blocks, you wouldn't know if you checked many years later. So let's say if your cholesterol is high for yourself, okay?
Yes.
You've just gone and checked.
Yeah.
Okay, give yourself 6 months, go and recheck again, see what your cholesterol is like, see what it's come down to. Now, when we talk about cholesterol, we talk about a few things. There's total cholesterol.
Yes.
It's broken down into a number of things. Triglycerides,
Yes.
HDL, LDL.
LDL.
LDL is the bad one, the very bad one. Triglycerides are the second bad one that can cause problems and blocks.
Oh.
HDL is often called the good cholesterol.
I see.
Okay.
For my reading, the triglyceride is actually low. HDL is high. LDL is high as well.
Yeah, so that's the one. So you can change your triglycerides significantly with diet and exercise. You can drop it 50% even.
Oh.
Your LDL can only be dropped with diet, maybe 10%, exercise, maybe 10%.
Wow.
So if you push really hard, you can get it down. But most of your LDL is genetic, produced in your liver. It's circulating. And if it's very high, you need medication. For yours, it's slightly high. Diet, exercise. See what things look like 6 months down the road. That's what I would suggest that you do.
when we mentioned about the lifestyle, and then you mentioned about the kidney, right? Does sleep, does lacking of sleep will cause the risk of getting heart attack higher?
Yeah, so there are studies that have shown that sleep is a very important thing for overall health. Lack of sleep can affect a lot of things. Lack of sleep can affect your brain power. Lack of
Yes.
sleep can affect your heart. So increased risk with lack of sleep is because you're putting undue strain on your overall body system.
Makes
You're
sense.
trying to push through without having the rest that you're supposed to have. Everyone's supposed to have at least 7 hours of sleep. People say
Okay.
8's even better. How many people really get that every night? Very
Yeah.
few. right? You get interrupted sleep. In my line of work, I'm an interventional cardiologist. So I in the middle of the night, I go in, I open up people's arteries if they're having a heart attack, ballooning, stenting, that kind of stuff. So my sleep gets interrupted as well. So all of us, there's other people who need to take calls from overseas. Their sleep gets interrupted.
Yes.
So what you need is actually 7 hours of uninterrupted sleep.
Wow.
So you will find that many people who have very busy jobs don't get that sleep. And with that lack of sleep, your risk goes up. When your risk goes up because your body doesn't get adequate rest. And your body doesn't get adequate rest because it's under stress. Now we say stress. Is stress a risk factor for heart disease? Yes, it is. Is stress a risk factor for heart attacks? Of course, yes, it is. And there's different types of stress. There's physical, there's emotional stress, right? So emotional stress can be psychological, can be emotional. That puts undue strain on the heart.
Okay.
Undue strain on the heart can also be put on it by lack of sleep. Okay, so that's that side of it. Then physically as well. Physically, lack of sleep puts stress on the heart too.
Yes.
But what are the other physical stresses that you can have? If you have to push yourself really hard physically for work, if you go and run an ultra marathon when you've never done it before, you go and you're a weekend warrior and you go in and run, and do football 3 hours and you only play once a month and you don't train yourself up, then you put your body under undue stress as well.
Yes. I mentioned of this. I heard of my friend mentioned to me like his friend after workout, right? Like pass on.
Yeah.
Is that even possible?
Yes, definitely. So the funny thing about exercise is your risk of a cardiac event is actually higher during exercise.
Oh.
But repeated exercise and training your body to overcome these stresses, training your body to cope with it, reduces your stress overall. So there are studies that have been done that show that during the time when you're running, especially people are doing long distance running or very heavy weight training, your risk actually goes up.
Wow.
But what you do is you train your body to reduce that risk to below what your norm was to start with.
Okay.
So that's how it works. So during that period, the risk is higher. Afterwards, the risk is lower because of repeated continuous exercise and conditioning of the body.
I see. Because I remember that his friend was about 40 years old. It's way too young, right?
Yeah, so he could have had, so remember we mentioned that it's not just blocks in the heart arteries, right? He could have had a congenital problem that he never knew about. He could have had blocks in his heart arteries. Bear with me, I'm going to get a bit of water.
No worries. Yeah, so I think one of the advice to the audience is just get yourself checked.
Yeah, whichever way, whatever your means are, go check minimum tests. If you've got a higher risk, family history,
yes,
known to have high cholesterol,
or maybe bad lifestyle.
Yeah, very stressful lifestyle. Then I suggest that you go and get yourself checked even more and more detailed tests. And the person who can advise you would be a doctor.
Yeah, like you yourself.
Like us. So cardiologists, GPs can do that too. You can go and see your family GP. You can go and see your polyclinic doctor and see what they can advise. And if, let's say, you're not happy with the advice that you've gotten, you can always seek a second opinion. You could decide, look, I want to check and see if my heart is a problem.
Yes.
Then you can go and see a cardiologist and do more detailed tests if needed. There are many tests you can do. Treadmill stress tests. I mean, an ECG starts, first of all. Treadmill stress tests. You can do CT scans of the heart arteries, depending on your risk profile. So we do that for a lot of our patients. We if there's a high enough risk, if they've got atypical chest pain, they're not sure if it's cardiac, if it's gastric, a CT scan tells you you've got a block straight off.
I see. Because a few years back, right? I think 3 years back, when my chest, quite frequently I will feel the numb, and then sometimes up to here, sometimes up to here, and I was like so afraid of me getting heart attack, right? So I went to hospital for a checkup. I went for the echo.
An echocardiogram, which is an ultrasound scan of the heart.
Yes, and an ultrasound. What else? They put something on my, like with the
ECG.
Yeah,
and
ECG.
you had to run on a treadmill.
No, not running on a treadmill, but just this feel. Nothing wrong about my heart.
Okay.
Then, miraculously, touch wood. I mean, this few years it didn't happen already again. Didn't happen again. But I realized like every time if I took coffee, my heart like this side will start to numb. So I'm not sure. Is this considered like high risk factor, or is there any?
Difficult to say. But coffee has one effect. It tends to speed your heart rate up.
Oh,
Caffeine.
okay.
It's a stimulant. So
True.
for some people, if the heart rate goes up, they get palpitations.
Yes.
The heart beats irregularly. They may feel some abnormal rhythm, or feel the heart is a bit faster than normal. And sometimes you don't feel it. But what you feel is the result of the heart rate going up, and that numbness and that funny feeling in the chest could be from that too.
Oh,
But generally, you should
okay.
get it investigated. They should do an ECG. You could consider doing a treadmill stress test. You're 30-something years
33,
old, 34. You're kind of young. You're not 40 yet. 40 was your friend.
Yeah.
Right? But, you could consider doing a treadmill stress test to
Okay.
see how it goes, because you have some symptoms.
Yes, that's what
So it might be
worries me.
useful to do that. I mean, we don't advocate just doing a treadmill for everybody if you have no symptoms, because then there's a big strain on the budget of any healthcare service.
Yes.
But if you go privately, you can also get it done, and that's not an issue either.
I see. Okay. I think I'm quite curious. Another question, I think, because I actually collected questions from my friends and family.
Okay.
Is it possible to have a heart attack while sleeping?
Yes, definitely.
How does that just, like what you explained earlier on, it just happened?
So the funny thing is, the studies have shown that the highest incidence of heart attacks is in the early hours of the morning, at the end of people's sleeps. That's the time when these things tend to happen a lot more.
Okay.
Okay. You can have a heart attack when you're at rest. You can have a heart attack when you're under a lot of stress. So let's say you did this unaccustomed exercise, you go running or playing a football game competitively, and 1 hour into the game, somebody gets a heart attack. You hear about this all the time,
Yes.
right? But you could also get it when you're resting, right? And I mentioned to you that 50% of people who get heart attacks, okay, when they go and study certain populations, have silent heart attacks without knowing that this was a heart attack to start with. So many of them get it at times when they don't expect it.
Yes.
And during sleep is one of them as well. So you can. And you've heard of a lot of stories, I guess, of people like who went to sleep and never woke up.
Yes.
Right? And I'm sure that's what that's
And
from.
it could be quite young, I think, because I saw several news recently that some celebrities, they had like this heart attack, 30 over years old, quite young.
Yeah. So it may be a heart attack, but once again, heart attacks are not the only disease or heart disease that exists. There are other heart diseases that could stop your heart.
What are the common diseases that could stop
So,
a heart
of course, most common, we mentioned heart attack. Other ones, heart muscle disorders, things that people are not aware of. They've had a heart muscle problem from childhood, congenital problem, didn't know about it. Abnormal heart rhythm. And that is sometimes also inbuilt, not that you developed it over time. There's an abnormality in the circuitry of your heart. It's how the electricity flows. So if there's an interruption or a short circuit, your heart beats because there's an impulse that stimulates the heart to beat.
Yes.
If that impulse is abnormal and it goes down and goes through an abnormal path or something like that, and it causes something called an arrhythmia, an arrhythmia is an abnormal heart rhythm, then that can cause certain symptoms in some people. But if there are also very serious arrhythmias, serious abnormal heart rhythms, a number of names are ventricular tachycardia, ventricular fibrillation. These are things where, let's say someone has a cardiac arrest, you need to do, cardioversion. You have to go in and use the paddles that you see like you see on TV.
I see.
Right? Okay? And you need to cardiovert. So these types of abnormal rhythms can occur at rest. And very often they occur in people when they're sleeping as well. And that's why people have sudden cardiac death.
Yes. And I heard some people, they may put something in the heart so that when the heart stops, it pumps the heart.
So I think what
What's
you're
that?
referring to is a pacemaker.
Yes.
A pacemaker. So once again, if there's an electrical system, so you got the top chambers, bottom chambers. If the bottom chambers keep throwing off abnormal impulses, you get these things such as I mentioned, ventricular tachycardia, ventricular fibrillation. If the top chambers beat abnormally, they can cause something called atrial fibrillation. Fibrillation just means the heart is fibrillating, like a bag of worms.
Yes.
And that can cause the blood pressure to drop and the heart to even stop. Okay? So these are things that can happen. But at the same time, you have impulses from the top of the heart to the bottom of the heart. And if there's an obstruction, it's like you've got traffic going down.
Yes.
Okay. And you've got a traffic light, and normally it stops the traffic light and moves on. But if you have complete obstruction of the traffic going down, and that's the electrical system, it's like a wire's been cut, then you don't get the impulses. And then what you need is to put a battery in with wires to pace the heart externally.
Okay.
Yeah, that's what a pacemaker is used for, because the heart does not have its own intrinsic beat at a fast enough rate. So the pacemaker goes in to make sure that it beats at least 60 beats per minute.
I see. Okay. That's interesting to hear.
Yeah, so that's why the batteries, you hear people having a battery there with a pacemaker wire in. Now, sometimes when people get this abnormal rhythm, which I mentioned, ventricular fibrillation,
Yes.
ventricular tachycardia,
Yes.
and it causes them to collapse, then this pacemaker battery with the wires can be upgraded to a better one that allows it to shock the heart. Okay, to defibrillate the heart. Remember I said to defibrillate the heart
Yes.
when they've got these abnormal rhythms? So this thing can also do that if the heart were to stop because you got this very serious abnormal rhythm.
I see.
Yes, there's lots of cool gadgets that we have, lots of cool equipment that we have to be able to help people and save their lives. Because cardiology is a very interesting subspecialty in medicine. It's advancing very fast. There's lots of new technologies, new things that we come up with to be able to save people's lives.
Could you share with us what are the new interesting technology that could save people's lives?
Making what we have even better. So let's say in the old days, the pacemaker, using the pacemaker analogy, you had normal wires. All you can do is improve the beat.
Yes.
But now if your left side and your right side cannot beat in unison, you can synchronize it with the wires.
Oh.
Yeah, so that they beat properly. Okay, the same way you can defibrillate. Okay, we said that. I'm an interventional cardiologist. I said once again, we do ballooning, we do stenting, right? So if someone's got a block in the heart arteries,
Yes.
we can stent it. In the early days, I mean, we're talking about 1960s, before the 70s, you did an angiogram where we pass a catheter
Yes.
up the arm,
Yes.
inject contrast inside. You got a block. If there's a block, there's no way to balloon it or open it. So all we used to do is bypass. So if you had blocks like this, you put grafts on top. And actually your heart model here
Yes.
is quite interesting because I've seen this for the first time for the audiences here, this heart model of hers. Normally the arteries come out here. This is a heart model of someone who's had bypass surgery. So this artery is taken from inside, or a vein is taken from the leg,
Yes.
and it bypasses the block in the heart arteries.
So, like for example, if let's say here's block, so
Yeah.
here's to bypass here,
Yes.
here.
To here. You don't remove the block in bypass surgery.
Oh.
Okay? So it bypasses, it goes over to here, you form a new conduit
Yes.
or a new passageway for the artery. Now, these can also block. It's not a cure. Then sometimes we balloon and stent them. So a very interesting guy, Andreas Grunzig, who's the father of interventional cardiology, invented the technology where you could pass a balloon down and balloon open a blockage in the arteries. So in the late 70s, this was invented. From 80s till about early 90s, all we did was balloon them open. But when
Yes.
you balloon them open, they used to occlude, right? Then cardiologists developed stents.
Okay.
Stents are scaffolds that hold the artery open.
Yes.
In the year 2000 onwards, we had stents with drug-eluting stents. The reblockage rates were very, very low.
Oh.
And now we're very advanced. And when you ask me what are the new technologies, better stents, better technology to put drugs around the metal inside that holds the arteries open. So now the reblockage rates are less than 10% for most patients
I see.
when you balloon and stent. And what in the past we could only do bypass surgery for,
Yes.
a lot of the time we can do ballooning and stenting without needing open heart surgery. So open heart surgery. So bypass surgery is open heart surgery. You stay in hospital for 5 days, minimum 7 days sometimes.
Yes.
Takes about a month to recover. But if you've got blocks which are not all over the place and don't need multiple grafts,
Yes.
you can balloon and stent them. The patient goes in, is awake. Someone like me does a procedure for them. Pass a catheter in, inject contrast, see where it is, pass wires, balloon it open, stent it and come out, and they're done in 1 or 2 hours.
You say like, yeah, I mean, the way you said it, like very easy. Like playing games and all that.
It's almost like playing a video game. We're doing this stuff here, and you're watching what we're doing on a TV screen up there. Is it very easy? Okay, it requires a lot of training to do.
Yes.
But when you've been trained enough to do it, then you can do it fairly easily enough.
I see. Okay.
Yeah. So these are all the new technologies we have. And now with patients who are very high risk, we've got special devices that can help the heart to pump or to pump the blood in and out of the chambers while we balloon and stent. And even if the heart stops, we can do all this and then get the heart going again. So there's lots of technology like this available.
Wow. I'm very interested to know, like, for all these technologies, right? How much does it cost averagely?
I think it depends on the technology. But if you go and do a balloon and stent procedure and there's a few stents, it could cost tens of thousands of dollars. Anywhere from $20,000 to $50,000, $60,000, depending on how much equipment you use, how much extra technology you use.
Yes.
If you use some of these very advanced technologies to help the heart to pump, there's a device called the impeller device where you pass the catheter in, you suck the blood out and push it forward. You add another 20, 30, 40,000 to your cost. So the cost goes up. Yes. Unfortunately, a lot of these new machines and new technologies don't come cheap.
Yes.
And that's not, I mean, don't get me wrong, it's not what we charge. It's actually the cost of the equipment itself.
Yes, the technology itself is not cheap.
Yes.
Let me look at the question.
This pillow is quite cool, actually, because you can just lean on it. This is your idea for all your guests.
Yes, my idea. And because it's look cute.
Cool.
Okay, could you explain the steps to take if someone is suspected of having a heart attack? Maybe from the symptom, like right from the symptom and until, is there any time frame for them to seek medical help?
So one of the things is what leads you to suspect, right? So is it the person himself, family member suspecting that they've had a heart attack, or a doctor attending to them suspecting that they've had a heart attack? Okay, so let's say you're at home, you get this severe chest pain.
Yes, like numbness.
Raining down the arm, numbness, all that kind of stuff. And you're feeling breathless, you don't feel well, think, God, something's really wrong. Of course, the first thing to do is either you or someone you know close to you, call 995.
Okay.
Very simple. Get the ambulance to come. They can assess you. They can bring you in, and it's fast.
Okay.
But let's say you had funny symptoms and you turned up in an accident emergency department and you're going in and I think I want to just go and get myself checked, and then the doctor there sees and says, oh God, you're having a heart attack. What step would they take? They would call a cardiologist or someone like us to come down and assess, first of all. Secondly, decide if the ECG showed changes of a massive heart attack. The ECG, right, is the one where you put the electrodes on. It shows changes of a massive heart attack. And then you'd be taken into a catheter lab where they would do an angiogram, balloon, stent, open everything up. Now, that is if a healthcare professional or a doctor was attending. Now, if you were at home, before you can call the ambulance, how would you know you need to call the ambulance, right? How would you know that you're having a heart attack? I've mentioned to you that 50% of people have silent heart attacks. Many people don't know. So you look out for the typical symptoms of chest pain, breathlessness, your blood pressure dropping, you feel like you're about to faint. Call for help.
Okay.
Get 995. Bring them down. Let them assess.
As soon as possible.
As soon as possible. That's what I think you should be doing. Because if you are suspecting you've had a heart attack, you need immediate help.
Yes.
And time is muscle. And if the heart attack is affecting your heart muscle, the heart muscle dies. Every few minutes you delay, more heart muscle is at risk.
I see.
Yeah, so that's what you need to do. But if you feel that you may have a block, then you're not suspecting you're having a heart attack. You say, I think I have a block, I have some symptoms. You can go and see your doctor, go down the normal route of the normal checkups that you need to do.
Speaking about the heart muscles death, right? Can we replace the heart muscles? Cannot.
There's nothing that's been created yet. There's no invention. People have tried. Many people have tried to do stem cell therapy for heart muscle. It hasn't worked.
I see.
Not yet. You can't replace it. So if the heart muscle dies, that means that part of the heart muscle doesn't function anymore and other parts have to take over. Unfortunately, that's the way it is. But you also have this period where if you have a heart attack and some of the heart muscle dies, there's other parts of the heart muscle that are at risk.
Yes.
And you manage to open up the artery and you reperfuse or give oxygen back to it and blood flow back to it, that part can recover.
I see. So can still have the chance to recover, not like...
Yes, if you have a heart attack, there's still chance for some of it to recover. The sooner you get medical help, the more chance there is of salvaging more of the heart muscle.
I see.
But if it's completely died off, there's no way to replace it with new muscle.
And can't recover as well if it's completely dies off.
Yeah, unfortunately. Yeah, that's unfortunately one of the things.
One of the shocking facts I heard is that 50% of the heart attack is without symptom. And
without the typical symptoms. Many people get, they think it's a bit of burping, a bit of uneasiness. It's not the typical symptoms. So people tend to disregard it.
Yes.
And silent heart attacks, meaning no symptom at all.
At all.
Happens in certain populations. Diabetics, because their nerves have been affected. If you're diabetic for many years, your nerves cannot sense it. If you're a bit older, ladies tend to have atypical symptoms more, a bit more epigastric pain. I remember this one story of a patient of ours who kept getting jaw ache, and she thought it was a teeth.
Yes.
She thought it was a toothache, went to see a couple of dentists, and at some point said, something's not right, went to the A&E department, and there were ECG changes. When the pain got really, really bad, she went in to get pain relief for what she thought was a toothache.
Yes.
And it turned out to be a heart attack.
So she had a heart attack.
Yes, at that time. And of course, we took her in, angiogram, angioplasty, balloon, stented, and she was okay. But jaw ache is something you look out for as well.
Yes. And you mentioned about the diabetic. How does diabetic relate to heart disease?
So there are a number of risk factors for heart disease. Cholesterol.
Yes.
Actually, we can call it even a cause of heart disease or blockages. Blood pressure can put more strain on the heart muscle.
Yes.
Smoking can affect the heart muscle as well. There's lots of chemicals in cigarette smoke that can harden the arteries and make cholesterol stick to it.
That's the smoking. Does e-cigarette considered as?
Yeah, it would. All types of smoking will have a risk, and it's difficult to figure out which ones have more. People talk about vaping. No one knows what's in the vapes either.
Yes.
So they all have a risk.
Wow.
And trying to quantify that risk is quite difficult. Okay. But we mentioned, the cholesterol, blood pressure, smoking, diabetes. Diabetes is what you asked me about. So diabetes actually is a heart disease equivalent. Diabetes alters the composition of the arteries. It makes the arteries more prone to blocks forming in them. It can affect your kidneys, your eyes, a lot of things can be affected by it. So diabetes is a heart disease equivalent. And all diabetics, if they've had diabetes for many years on end, eventually develop some cholesterol buildup in their arteries. All diabetics eventually get some blocks. And that's why if you've got diabetes, we try to control two things, most of all. Control the diabetes to start with. The sugar has to come down with medication.
Okay.
If the cholesterol is in any way high or even moderately high, and there's the guideline or the target for diabetes is less than the normal population. Anything above a certain number, and that number for those of the listeners who are listening, if your LDL or bad cholesterol is more than 2.6 on the millimole scale or 100 on the milligram per deciliter scale, your LDL is not controlled. You need to go on a cholesterol tablet. So we control that. And then you control blood pressure. For diabetics, the blood pressure target is lower than for a normal person as well.
Oh.
So that's why diabetics end up being on a lot more medicine straight off,
No
because
wonder.
diabetes is a heart disease equivalent. Increased risk of heart disease, increased risk of stroke.
I see. That's
Yeah, it's a bit of an eye-opener because many people think, diabetes, just control your sugar.
Yeah.
Diabetes, just don't eat so much sugar.
Yeah.
But diabetes is not about eating too much sugar. There are people who drink 10 cans of Coke a day and don't get diabetes. There are people who hardly eat any sugar and get diabetes, because diabetes is genetically predetermined. Diabetes is your body's inability to process sugar. It's not that you're having too much sugar.
I see.
Of course, if you have diabetes and you subsequently take a lot more sugar, your diabetic control will be quite bad.
Wow.
Yeah.
I learned a lot today. A lot of interesting facts.
Sorry, I keep rambling on. I keep telling you stuff. But look, it's useful, I think, for the listeners to hear all this.
I think the things that you have been sharing, it's all very useful. And I think it's very mind-blowing.
Right.
Diabetic, blood pressure, cholesterol.
Yes.
The basic three high
you hear about, all the time.
Okay. In short, just keep track of this three.
Well, there's a lot of other stuff you need to keep track of as well. There's weight. Try and make sure that you keep healthy, try and eat healthy. All that comes into it as well. But that affects these three: diabetes, blood pressure, cholesterol.
Yes.
Blood pressure is another thing. People don't get symptoms from it. Blood pressure, there are people who are overweight who have normal blood pressure. There are people who are very slim who have high blood pressure because it's genetic. The most common cause of all these things is that you're genetically predisposed. Your risk is higher because you have a predisposition for it.
Mention of this genetically predisposed, right? Does going for this DNA testing helps?
So DNA testing is a gray area. There's DNA tests and there's DNA tests. Some DNA tests are very accurate, some are not. Some are marketing, So if you go for a DNA test, it may tell you you've got a predilection or a predisposition for developing a certain type of disease.
Yes.
It doesn't mean you will have it. So then once you have that, what do? You make the lifestyle changes to reduce your risk for that.
Yes.
So why not just make the lifestyle changes to start with before you even do the DNA test?
True.
Okay, so this is what I'm thinking. So why would we need to have to do all that? Now, there are DNA tests for breast cancer, the BRCA gene. Famous person who did that is Angelina Jolie. Right? You could go and do that. Very expensive test. You could decide if you want to do that. There are pros and cons, and people need to be counseled on what happens when you do a DNA test. So first of all, you go and do a DNA test, and it comes back that you've got a high risk of Alzheimer's. You've got a high risk of a certain type of cancer.
Yes.
You've got that test result. You want to go and buy an insurance policy.
Yes.
You have to declare it, perhaps. So there's all this gray areas with DNA tests as well. Unless a DNA test, in my mind, I think would be useful if you can do a DNA test. Based on that, you have a treatment for that particular problem, then I think it makes sense.
I see.
Otherwise, I don't think so.
Yeah, because DNA test is not cheap either.
No, it's very expensive. It can be full. It can be 6,000, 7,000, 8,000. I've seen people pay that kind of money for DNA tests.
Wow. The one that I took is just like 200 plus. I'm not sure.
And it may not be very accurate for all you know.
I'm starting to questioning the accuracy.
Yes.
Okay.
Yeah. So I have never done a DNA test. I don't see the need for it.
I think like what you said, just control your lifestyle, because everything starts with lifestyle, right?
Yes, start with that. Do what you need to do, then it's okay.
Because the rest is all genetically predisposed, right?
Yeah.
So whatever things that we can do is just...
Yes.
Oh, another question. Does drinking alcohol increase the risk as well?
So everything in moderation, right?
Yeah.
So alcohol in small amounts does no harm. Alcohol in large amounts definitely does a lot of harm, right? Can affect your liver, can affect your kidneys, can affect your sugar metabolism, can make you gain weight. So can alcohol cause a problem? In moderation, small amounts here and there, a couple of units here and there, I think relaxes you. Stress is a major killer. Stress is a major contributor to heart disease. If alcohol reduces that stress, a little bit of it is fine.
Wow, okay.
A lot of it is not.
Yes.
Right? Now, the problem is, can people draw the line between what is a little bit and a lot?
Yeah, I think that's very hard.
Right, and that's the difficult part. Just like food. They say everything in moderation. If it tastes too good, if it tastes really, really good, it's probably quite bad for you.
Yeah.
Okay. But
agree.
if you can control the amount of it you eat, then everything is all right. But where does that control lie? And I think that lies with the individual.
True. I have a couple of interesting questions here. How has COVID-19 impacted heart health, and what precautions should the patients take?
So COVID was a difficult period in everybody's lives. It changed the way we deal with things. It changed our outlook. COVID is a viral infection. Can viral infections affect the heart? Yes. For years, we've known. There's many viruses, Coxsackie virus. There's a number of these other influenza viruses. People can have viruses that can attack the heart muscle. It's been known for a long time, but we never had a pandemic
Yes.
that was this big affecting the heart muscles. So COVID, many patients who got COVID had lung-related problems, but also had heart-related problems. It affected the heart muscle. There was myocarditis, which you've heard of in the news,
Yes.
which caused something called cardiomyopathy. Inflammation of the heart muscle is myocarditis. Cardiomyopathy is heart disease
Yes.
and cause heart muscle to be weakened. But this has happened with other viruses as well. So it's not something that's new, but COVID was particularly harmful. So we started seeing more patients with heart muscle problems, more patients with arrhythmias.
Yes.
Remember I mentioned abnormal heart rhythm,
Yes.
irregular heart rhythm. Many more patients started getting this with COVID.
With COVID, what about like post-COVID?
Yes. So, and then with COVID as well, there were slightly more heart attacks because there was a higher risk of thrombosis or clots forming. So this happened as well. But then what happens is this then translates into a continuous problem that continued for a while for a lot of patients. They continued to have symptoms for 3 to 6 months. So we started seeing a lot more of these. So COVID did impact heart health, did impact heart disease. It did increase the incidence worldwide. But with the advent of the vaccinations, all this dropped again. The long COVID, the lung disease, everything dropped. But then you had the other thing there, the vaccinations also had some side effects
Yes.
on the heart. So, but then if you look at it, the effect of COVID is high up here compared to the effect of the vaccinations.
Yes.
So you're not comparing like for like.
Yeah.
So the risk from the original COVID was a lot higher. So the vaccinations dropped that. So we did see an initial surge, and after that it dropped again.
I see. Okay. So the vaccination may affect a little bit of the heart, right? But then it's not as much as the COVID
As
itself.
COVID, and not as risky as the COVID in itself. So that's why we as healthcare professionals still vaccinate ourselves
Yeah.
and advocate as well. Unless you've had a reaction to it,
Yes.
then perhaps you're one of those that would have a problem. It doesn't make sense to have the booster.
Correct. Like, I heard one of the Grab driver, he mentioned to me like after he took the booster, he had this heart attack symptom.
Yeah, so some people have had that. So unfortunately, there is a risk. It may be 1 in 100,000. It's low,
Okay.
but it does happen as well. And so the advice was after the vaccinations not to exercise for 2 weeks. But that was the same advice after you recover from COVID. Don't exercise for 2 weeks. Because
No wonder.
what you do is you increase your risk of abnormal heart rhythms or sudden cardiac events.
Yes, like you explained earlier on, like you imposes unnecessary stress to your heart, right?
There you go.
I see. And when we talk about heart attack and stroke, right? How does having heart attack and stroke impact life expectancy and the quality of life?
So if you've had a heart attack, your risk of getting a second heart attack is higher.
Oh, reoccurrences.
Reoccurrence. If you've had a heart attack, your risk of getting a stroke is higher. That's what the data shows because the disease is similar. It's cholesterol plaque buildup. It's blocks forming in arteries and that kind of stuff. So your risk goes up no matter what.
I see.
Can it impact your longevity? Yes. Okay. But with the current technology that we have, we live in a great age. We've got a lot of very cool, good technology, as I said.
Yes.
We can improve outcomes. and therefore prolong life. And it can make it almost as good as if you never had a heart attack long term, as long as your heart attack was not a big one. Now, if your heart attack was a massive heart attack that killed off 70% of your heart muscle,
Yes, that would be hard.
yeah, then it's difficult because then your pump function is low. Then your heart reserve is low. Then, of course, it will affect your overall outcome, perhaps your longevity as well.
I see. I'm just curious, like for those, like you mentioned, 50% is without, like majority is like without symptom. How can these people actually prevent from?
I guess regular checks with the doctor, looking at your risk factors. I mean, if you're fortunate enough to be able to go and have checkups done, normally get an ECG done, get an echo like you did the last time, once in a while, then you can prevent it. But generally at a population level, it is quite difficult. So then what we try to do, or what the government tries to do, I guess, is have this healthy SG type programs where you go, you check yourself. If things are identified, then it's escalated to the appropriate authorities. So everyone starts from an early age, and that's the way to do it. That's how you prevent it.
It's about educating as well, right?
Educating, being aware, understanding that these are risks.
Yes. And is there any relation between exercising with, like, in promoting heart health?
Sorry, I'm trying to understand. Is there any relationship between exercise and heart health?
Yes, like can exercising regularly helps in, generally heart.
Reducing your risk? Of course, definitely. So regular exercise, moderate intensity, and we're not talking about very high intensity, will reduce your risk overall. Because remember I said, when you exercise, your risk goes up.
Yes.
But at the time when you're exercising, if that risk may go up 1-2%, okay, you run that risk, right?
Yes.
But then if you exercise regularly, overall, over a prolonged period of time, your risk goes down. And that's what the graphs show. And that's where you see the big difference. So maintaining a healthy lifestyle, maintaining a healthy diet with exercise will reduce your risk of heart disease, of having a cardiovascular event, significantly long term. Right? But then one of the funny things is that many people have not realized is if you exercise excessively, sometimes your risk goes up. You have a higher risk of abnormal heart rhythms. You have a higher risk of getting a heart attack from pushing too hard. So I mean, we always talk about the story of marathon. Do you know how the marathon run originated? There was a guy in Greece, said the Persians were attacking, ran that distance from Marathon to Athens, and informed them the Persians were arriving. And at the end, when he reached the final distance at 42 kilometers, he died. So the first guy who ever did a marathon run died. So the thing is, if you're not accustomed to doing something like this, then your risk goes up. So exercising too much or pushing too hard when you exercise can increase your risk. But overall, exercise reduces your risk.
Exercise regularly and not over-exercise yourself.
In moderation.
In moderation, yes. Right.
That would make all the difference.
For the last question, could you share maybe one or two misconceptions that people might have about heart disease?
Okay, that's interesting.
Maybe one or two, the top misconception that you could think of.
Okay. If you've got blocks in your heart arteries, the only way to reduce your risk of that block progressing is to go on a cholesterol tablet. Okay, and that would include, at the moment, all we have are statins. Statins have been around for a long time. Simvastatin, atorvastatin, rosuvastatin. People know them as other names like Crestor, Lipitor. Okay, so if you go onto the internet, you will see a lot of negative stuff saying, oh, don't take this, bad for you, harmful, or you should never take cholesterol medicines. It's all a conspiracy by the drug companies.
Okay.
That is one of the biggest misconceptions because these are the drugs that save people's lives.
Okay. Wow.
As part B of that same thing, the cholesterol medications cannot remove your blocks and make your heart arteries normal. What they do is prevent progression or slow down progression. So let's say if you had a 50% block.
Yes.
We always say by convention, if your block is 70%, 80% or more, you put a stent in, balloon and open it up, right?
Yes.
Balloon and stent and open it up. Leave the stent in to hold the artery open.
Yes.
But what you want is for that 50% not to become a 70%.
Right.
And the only way you can do that really is go on a cholesterol tablet and make lifestyle changes. And that cholesterol tablet reduces your cholesterol or your LDL 50% to 70% and reduces progression significantly. So the biggest misconception is that these drugs are bad for you because these drugs are what save your life. Right?
It's powerful to hear.
Yes, misconception number one.
Okay.
And I gave you part B to that. Part C to that is that you can decide not to take that medication and try lifestyle change instead to bring down those blocks, especially if you've had a heart attack. Many of our patients tell us, I don't want to take medicines. Medicines are bad for you. Medicines are poison.
But they have already had
a heart attack. And so they say, I don't want to take it. I don't want to be a patient. I don't want to take medicine. I will try alternative methods. And they end up with a heart attack subsequently. All rolled into one. These are all misconceptions that need to be corrected.
Thank you for sharing.
Yeah.
What's the second misconception?
Well, I gave kind of 3 parts within one.
Yes.
Okay. That certain supplements can replace these medicines instead. So people think omega-3 fatty acids reduce your risk of a heart attack. They don't.
I am taking the omega.
It's okay. It's good for your eyes, good for your joints.
Okay.
Brings down triglycerides. It does not have any effect on LDL. It cannot bring down LDL.
Because you mentioned that LDL is actually genetically...
To a large degree. And LDL is the bad cholesterol that causes heart attacks. So omega-3 fatty acids cannot reduce LDL. It's a big misconception. So it's sold in lots of bottles. Omega, reduce your heart attack risk. Omega, reduce your cholesterol.
Yeah.
It'll reduce your total cholesterol by reducing triglycerides. It has no effect
I see.
on LDL. LDL is the killer. LDL is the one that causes the blocks. LDL is the one that causes the heart attack. And omega does not reduce that.
Wow.
There's been 1 or 2 studies that have shown some advantage with omega, and all the companies, supplement companies, are using that to promote selling omega. And you see them saying omega reduce heart attack, omega heart health. Not true. Misconception. Omega is good. Reduce your triglycerides. Overall, a little bit of advantage for heart health, but it's not a substitute.
Not the main LDL.
It's not a substitute for the medication.
Okay. Let me try.
I'm not stopping people taking omega. I'm not saying you shouldn't take omega. It can be good for your joints, good for your eyes.
Yep.
Bring down triglycerides if triglycerides are high.
Yes.
But it has no effect on LDL.
Just don't have the misconception that this will bring down the LDL, at least.
And reduce your risk of a heart attack. No.
Okay, let me try to sink in my learning points today. Okay, I'm gonna... First learning point I have learned today. Cholesterol is the number one that causes the block.
Yes.
Correct me if I'm wrong.
Yes. You're very right.
Okay. Blood pressure, high blood pressure, diabetic means the sugar level.
Okay, good.
Okay, need to regulate that.
Yeah.
This 3 is actually the main causes. But the main which causes a block is actually the cholesterol.
Yes.
First takeaway. Second takeaway, like what you shared earlier on, the cholesterol tablet can reduce the heart attack efficiently.
Reduces that risk by 50%, yes.
Okay. The third takeaway that I have today, let me think.
Omega.
Yeah. Omega. This is very, very interesting because I really used to think that by having the omega-3, it can bring down my cholesterol. Like what you say, correct. If it's bring down my triglyceride, overall cholesterol will bring down.
The total comes down.
Total, but not the LDL.
Yes.
Yes.
This is great. If only we had students like you. You take all the lessons, you listen very carefully. It's actually true. You listen very carefully, take all the points, you can summarize. This is fantastic. You must have been a very good student.
I was like so focused, and I was like trying to vision, like it's in my mind, like around, like everywhere. Okay. Thank you for the lesson, teacher.
Yes, ma'am. Thank you. Thank you for the opportunity to share.
Yeah, I'm sure the audience will learn a lot as well. And yeah, thank you so much.
No, thank you. Thank you. And I hope that, there's a lot of these takeaway points. You've summarized it very well. A lot of the stuff we talked about. We did talk about other stuff as well, like heart disease, how you balloon and stent, how you fix them, how you can do surgery, how we live in an age where there's a lot of new technological advances.
Yes.
All that is in there too. So I hope everyone gained from this.
Yes.
And I gained from being here because I get a chance to crystallize my thoughts and share a little bit as well.
Thank you. Such a humble personality. Thank you so much. And I hope to have you again in future. And we will see what kind of lesson we can conduct the next.
Yes, of course. That'd be great. Yeah. Fantastic. Thank you so much, Candy.
Thank you. Thank you for being part of this incredible dialogue. We hope this episode has inspired you to embrace heart-to-heart dialogue in your own life. If you love to share your stories with us, DM us, comment below, or use the hashtag #HTHDstories. Your voice matters, and we can't wait to listen and learn from you. If you enjoyed today's conversation, don't forget to subscribe and share this episode with your friends. Remember, every genuine conversation has the power to make a difference. Let's make an impact together. Till next time.